Good afternoon, everyone. I'm here today with Dr. Nevin Parish, and I'm going to tell you a little bit about him in just a moment. We often get asked at the restaurant from our customers for local recommendations for all kinds of things. And I love to share other local businesses that excel at what they do. So I'm pleased to introduce you to Dr. Nevin Parish. He's the owner of CNY Family Chiropractic, which is based in Manlius, so just over the road from Chittenango. Dr. Parish specializes in conservative healthcare that allows the body to work as well as it can without drugs or surgery. He has certifications and training in assisting with pregnancy, assessing gait and foot structure for pain and dysfunction. He works with spinal disc injuries and therapy. And apart from his doctorate in chiropractic, he also holds a master's degree in applied clinical nutrition. That's pretty impressive, Dr. Parish. So
Thank you.
we're gonna, yeah. So we're gonna jump right in. I'd love if you could tell me a little bit about your background, how long you've owned the practice, and what you did before owning CNY Family Chiropractic.
Yeah. So started off with the education. I did a 4-year bachelor's degree in biology, St. John Fisher. Then took the better part of 4 years to get the chiropractic doctorate as well as the master's in nutrition that you mentioned. Right out of school, I worked in Watertown for the better part of 3 years. Worked in a really busy office. So I saw a lot of different patients, a lot of different patient types. And it was great as a young doctor because I not only got to get my feet wet, but I saw a volume of people that most doctors wouldn't normally see. So I got to get a lot of experience very young. I decided 2.5 years into that work environment that I wanted to slow down. I wanted to spend more time with people and really tailor care to individuals. So I found that CNY Family Chiropractic was for sale, and I purchased the practice from Dr. Joe Rosny in November of 21 or 22. So I've been here ever since. I've added a few things to the practice. We now have the spinal disc regeneration therapy, as you mentioned. I offer nutrition therapy as well, some foot gait analysis, and the practice has been going great since we purchased it.
That's awesome. Well, you're definitely a welcome addition to the community for sure. And I love that your practice has so many modalities. So it's not like they're just coming in for one thing. You can really assess multiple things and really work and tailor care for the individual patient. So that's pretty awesome.
Absolutely.
So tell me, what are some of the common complaints that you see every day? What does a typical patient encounter look like for you?
So my average everyday patient is a wellness patient. They are coming in not just to treat things, but to stay healthy, to stay moving, and to prevent problems from going forward. That being said, most of the people that start with me do have some type of active complaint. So whether that's a neck problem or a low back problem, there's a number of different therapies I'll offer based on what they have going on, sometimes based on imaging like an X-ray or an MRI. And the goal is to get them not just feeling better, but functioning better, meaning that they are able to do all the daily tasks that we may take for granted. They can do those tasks without any difficulty. And then from there, they transition ideally into a wellness patient so that those issues don't come back.
Gotcha. Gotcha. So what should people who don't see a chiropractor look for to know if it's time to see you?
So this is one of my favorite questions because most people, if you were to ask the average individual, they would say, you go to the chiropractor when you're hurting. I hurt my back. I hurt my neck. I'm going to tell you something different. You should go see your chiropractor when you're noticing tightness, stiffness, or that you're not moving the way that you otherwise would for whatever reason. If you're hurting, that means there's likely some damage that has already occurred. So we're behind in that sense if we're already having pain type symptoms. So what I tell everyone to look for is, do you feel like you're not moving the way you were a week ago or 2 weeks ago? Definitely if you feel like you aren't moving the way you did 10 years ago, it's probably time to start with some type of care.
That makes sense. All right. And what does a typical patient look like? Are they typically older, younger? Are they in shape, out of shape? Tell me a little bit more.
So what's great about chiropractic is we can use the chiropractic therapies to help people from a whole host of different backgrounds. I adjusted my son when he was only a few hours old. I have patients that are actively under care here who are in their mid 80s, and I've seen people as old as 97, 98 years old. I love to work with athletes, for instance. So it's not so much what individual patient can you work with, but what patients do I tend to see, the different types of folks I tend to see. Obviously, people that are, say, mid 40s and older, they tend to have more injuries, more aches, more pains. But that doesn't mean I don't see a number of children. Young athletes is a very common subgroup as well. So really, chiropractic can work for most anyone. It just has to do with what you're doing in your daily life and what therapy is best for you.
Yeah, I love that. And I love that it can really be like preventative care. It just doesn't have to be, when something is severely wrong. So people can shift how they look at it. I love that.
Absolutely.
Yep. Okay. So I know you have a separate degree in nutrition. How do you incorporate that with your patients and what does that look like?
So whenever I have a new patient come in, I have them fill out paperwork. On that paperwork, I ask, what supplements are you currently taking? What are your nutrition goals? What medications are you on? My job is not to tell someone not to take medication, but if someone's coming in, say, and they're on like a statin medication, it's a good idea for them to take CoQ10. And there's a whole host of reasons. I won't get into the weeds of that. But based on what someone's goals are, there may be different things that we can supplement with or that we can change with the diet that may help them achieve their goals more efficiently or quicker.
Awesome. That sounds great. Now, I know that one of the biggest concerns right now in healthcare in general, and when you're looking to schedule a visit with any kind of practitioner, it likely takes, some people are booking out months to get an appointment, right? And so tell me a little bit about your practice. Like, how long does it take to get into your office? Do you need a referral? Tell me a little bit more about that.
Yep. So I'm going to start with the referral question. Chiropractors are considered primary care doctors, so you don't need a referral to come and see me. And then with regard to time frame, I pride myself on being very efficient with my time. If you are waiting here 10 minutes for your appointment and I haven't seen you, something's wrong. I'm very punctual. That means that the patients are going to come in, they're going to be seen within 5 minutes of their appointment time. That also means I'm not wasting time trying to get people in and out. I can almost always get you in within 24 to 36 hours. I can absolutely get you in within the same week. And it depends on the type of therapy we're doing. For instance, if you're doing a spinal decompression therapy, there it's based on when the table will be open or when it's booked. So sometimes it takes a day, maybe two, to get in for a therapy like that. But you're definitely not going to wait months. We're talking more of a matter of later today, maybe later in the week.
That's awesome. That's really great to know. Thank you so much for spending a few minutes with me and just kind of sharing a little bit more about yourself and your practice. We're really fortunate to have such a qualified, wonderful chiropractor right locally, in the area where it's easy for folks to get to. And I know personally, I've been a patient for, I think, a little over a year now, and I've been super satisfied. And you've also been able to help others that I've sent along your way too. So I appreciate that. Guys, definitely check out Dr. Nevin's practice. He's right over the hill in Manlius, and get to know him and see what he can do for you guys.
Thank you.
Thanks.